the CDC guidelines have been confusing. They've been befuddling. They have seemed to defy science as we know it in some ways. But I guess this is the reality. And this is probably why they changed those guidelines to reflect exactly what we were seeing right now. I mean, I don't understand why they didn't say that at the time. But knowing that you're going to have, what did you say, 1% of the population being infected, having 10% infected at any point in time as we've been moving through the last several weeks, is that what the CDC saw and knew? Is that why we've gotten this kind of crazy guidance?
Well, I think the CDC guidelines reflected the reality that a lot of the spread right now is being done by people who are mildly or asymptomatic and aren't turning over their infections. And so to impose all the regulations and restrictions on a small percentage of people who are actually getting diagnosed and self-isolating isn't going to control this epidemic. Just like we're not doing contact tracing right now. A lot of schools aren't making recommendations to quarantine students when there's a case in the class because there's just so much infection that you're not going to be driving this epidemic by the infections that you're turning over. I think with respect to the CDC guidance more generally, I mean, the reality is that the CDC is not an agency accustomed to talking to the public. They usually issue their recommendations through public health agencies to providers. In this epidemic, they were thrust into a position of having to issue bottom-line recommendations to consumers. It's not something they do. And I think we made a mistake all along for the last 2 years looking to the CDC for guidance on how we were going to live our lives, when we really should have been looking to more local authorities for that kind of guidance. Ultimately, you need to reform the CDC. We need some kind of federal public health agency capable of doing this. But CDC was not that agency. And it's very hard for an agency to self-organize and reform itself in a setting of a crisis. CDC has been unable to do that.
Are businesses and schools and other organizations that are following the CDC guidance and the recommendations then doing the right thing? And I ask because every organization I know right now is copying what the CDC is telling to them to do, including saying you can come back after 5 days with or without a test, and you can wear a mask, but the type of mask you choose is up to you. If you want it to be cotton mask, that's fine, too. Literally every organization I know right now is following that. And maybe it's not a problem in a lot of places like schools and other places, but maybe it is a problem when you start to get to places like hospitals because they are pushing to have doctors and nurses come back quickly. That's going against what nurses unions have requested, what against the American Medical Association has said, what against the American Cancer Society and their concern about having cancer patients in close proximity to people who have come back with knowing that they still are probably infected and not even telling the patients at that point.
Yeah, look, this is the challenge because private businesses, local governments want some authoritative entity that they can tie their decisions to and help inform the guidance that they put out to the local communities. And people look to the CDC for that guidance. But the reality is that the CDC guidance is general in nature. They don't describe why they make the recommendations. So you can't decouple their recommendations and actually incorporate them or tweak them. And they're always slow. They're slow to update those recommendations based on evolving science. Now you hear speculation that they're going to make recommendations to consumers to try to seek out higher quality masks. That's something that should have been done a year ago. When Delta emerged, and it was very clear that it wasn't spreading primarily through droplet transmission, but was more of an airborne virus, more like measles than like flu, we should have made a recommendation to people who need to protect themselves, who need to use a mask to protect themselves, to seek out higher quality masks, because a cloth mask isn't going to be protective. It might reduce their risk of transmitting the virus, which was the original reason why we recommended masks in the first place, so that asymptomatic people wouldn't be transmitting the virus in public. But that cloth mask isn't going to be protective to you in terms of reducing your risk of contracting the infection if you're in a confined space where the infection is circulating in the air. So for high-risk individuals, they always needed to seek out higher quality masks, certainly once Delta emerged. And the CDC is finally getting around to considering updating that recommendation to consumers.
Sure. I'm curious if you could comment on where you think we are in terms of the production of rapid tests and the value of rapid tests. The Biden administration just announcing that families will be able to get up to eight COVID rapid tests insured, or effectively forcing the insurance companies to do it, which is different, I think, than the free program, which still seems to be challenged because we haven't seen the website where that's available. But what do you know about the production, and when will they be available at scale? And frankly, will it be too late, given where we are on the peak?
Yeah, look, there's substantial supply coming into the market. Abbott's talking about producing up to 1 million tests per month. There is supply available. I mean, even if you go to Amazon right now, you can access high-quality rapid tests. They're still expensive, and I think with respect to trying to make them available to consumers, it's still cumbersome to purchase this test if you can find it. and file an insurance claim. I think we really should be in the setting of these waves of infection when we know that we want more people to be doing routine testing. We really need to find ways to push them out to consumers. Consumers who are going to seek out the tests and file an insurance claim aren't the ones who are having trouble getting access to the tests. It's the ones who aren't going to be able to find the time to do that. And for those consumers, I think distributing them at a very low cost, $1 a test, $2 a test at a pharmacy, you have some de minimis amount that you charge for the test, perhaps, or you just give it away free. But even if you charge a de minimis amount, you subsidize it and provide it at the point of purchase, like pharmacies. That's what they're doing in the UK. That's what they're doing in Germany. They have much more ubiquitous access to testing. Now, do some tests get wasted? Absolutely. Do people who can otherwise afford a test get access to those free tests so you're not targeting the resources to those who most need it? Yes, that's going to happen. But if you want to make this ubiquitous and widely available, you're going to have to accept some of that to try to push these out directly to consumers.